Derek. It's really given me a challenge. It's a very hard act to follow, so I'll do my best. This is going to be a little bit maybe less inspirational and more talking about what's the reality. It's something about reality and what we can do about it. My career has been mostly healthcare for underserved populations, and I have wandered since I left the employed world into looking at environmental issues and discovered how little I knew and how much I needed to know. And yes, climate change is important, but most of the things that I'm going to talk to you about are not climate change. There are other aspects of the environment that affect outcomes, and they're things we can do something about. So let's see, how do I advance the slides here? The green button, let's try that. Okay, so now I'm going to start out with some definitions, and these definitions should be known to most of you, so I'm not going to spend a lot of time talking about them. A lot of this is about equity, it's about fairness, and how we bring fairness about. And the social determinants are those things which are the conditions that affect people in various different ways. We're going to look at how several of those are affecting environmental issues and the outcome. And then, of course, racism. We have to not be afraid of confronting what we are seeing in our society. And whether you call it diversity, equal opportunity, whatever you call it, we need to work to overcome those things. But that, first of all, involves our recognizing, people have talked about the fact how we've all been inculcated and experienced things that we have to overcome in overcoming our own ethnic particularism, I'd call it, to be more egalitarian about the way we approach it. And then finally, a disparity, because we're talking about disparities, is a situation in which two or more things are not equal, and often that this is unfair. And therefore, we have to bring fairness into the situation. So I'm going to talk about Dallas, where I live, because history is always important. And according to the Urban Institute, Dallas is the worst city in the United States for neighborhood income inequality. A couple of statistics, 75216, which is a zip code that I'll talk about later, in South Dallas, has the second lowest life expectancy for an African-American male of any zip code in the United States. The average life expectancy is about 67 years. In Highland Park, a very wealthy community, the average income in 75216 is about $30,000 a year. In Highland Park, which is 5 miles away, it's $320,000 per household, and the average life expectancy is 92 years. That illustrates the discrepancies that we're facing. We're worst in states in most social disparities, whether our governor and attorney general and legislature wants to address it. We have work to do to bring better conditions. On the other hand, Dallas has developed and adopted an equity plan and a number of supporting efforts. And we're going to talk in the environment about one of those supporting efforts. In 2020, Dallas developed the Comprehensive Environmental Action Plan, or CCAP. CCAP is a very extensive, well-researched document. They had created an environmental commission. The environmental commission is 15 voting members, one from each council district. I represent District 12, which is in far north Dallas, one of the more wealthy districts. The mayor also gets to appoint a representative. And then we have 6 non-voting content experts. Those content experts are experts in the areas which have goals within the CCAP. So we have a water expert, an air expert, a alternative energy expert, And then we have subcommittees. We have an environmental justice committee. We have a health committee, which I'm the co-chair of. There's a strategic planning committee. I also serve on that committee. And each CCAP has an action plan with objectives and things to accomplish, and we look at how well are we achieving those concrete objectives which are in the plan. So far, we've achieved about 60 to 65% of the objectives, but there's still major work to be done. Now, a little about history and equity. Texas, of course, as everybody knows, was a slave state, a member of the Confederacy. Before, of course, it was a state. It was part of Mexico. Texas passed its first Jim Crow laws right after the end of the Civil War. Give you an idea, I think Mississippi and maybe Louisiana, one other state, were the only states that had Jim Crow laws before Texas. There's a long history of racial discrimination in Texas. Dallas started in what's now downtown Dallas and spread in all directions. As it grew, it absorbed a number of agricultural communities which had started after Juneteenth. People settled in areas mostly in southern Dallas, but we had some as well in the northern and east part of Dallas. And these were called freedmen's towns, and those are examples. I'm presently involved in doing work in Bonton, which has a fabulous community farm. They, as part of that, they work with ex-offenders and teach them things in the food industry. And they have a wonderful restaurant. If I have a business lunch in South Dallas, I'm going to Bonton. The food is great. And it was recognized about 3 years ago as one of the 10 best new restaurants in Dallas by Dallas Magazine. That's how good it is. Joppy, which we're going to, 10th Street, one of my friends who is a developer of affordable housing grew up in Clarendon Homes, which is a housing project on 10th Street. He has built $300,000 homes across from the housing project he grew up in. It's a great success story, but he has a wonderful view for the community and has helped me understand the situation. Joppy, we're going to talk about more later. I'm going to hold that one off. And the bottom, and I'm going to show you new housing in the bottom and what we've been able to do in the bottom working with the church, Golden Gate Missionary Baptist, which has been in that community for about 100 years. However, as they absorbed those communities, Dallas, the city did very little. Remember that we are a city that had at least two of our mayors who were members of the Ku Klux Klan. So it tells you, again, something about the history. Matter of fact, our major freeway that leads into the black community is still named for a guy who was in the Ku Klux Klan, Mayor R.L. Thornton. Dallas also, like many other cities, used freeway construction to fence in the minority communities along with redlining and discriminatory home practices. And I heartily recommend the book, The Color of Law by Richard Rothstein, who lays out how our policies serve to further the segregation of communities. In Dallas, the city leaders saw what happened with Brown versus the Board of Education, and rather than want to confront directly, as was done in Mississippi and other areas, they decided they didn't want confrontation. So they did several things. First of all, we had no national banks. If you were a faith leader, a pastor in South Dallas who wanted to speak up in favor of desegregation, your ability of your church to borrow money suddenly disappeared. Okay. If you wanted to run for office and you were willing to keep your mouth shut, you got money from the business leaders in the Dallas Citizens Council, who didn't lose an election until about 10 years ago for about 60 years. They were able to dictate who won the elections by directing the money. The freeway situation. If you take our two major, the freeways typically branch out from downtown Dallas. If you take where my hands are, between I-35 and I-45, 43% of the population does not have daily access to a vehicle. About 90% of the population that lives between those two freeways is Latino or African American. They were fenced off. There's a wonderful book called The Accommodation about how that happened and how the city leaders forced out the white population of South Dallas and forced in the African American population to segregate the city. And my dear friend Peter Johnson, who fought against that, is one of the heroes because Peter unsuccessfully tried to keep that from happening. Dallas County does a needs survey. And by the way, I think our political culture in Dallas has really changed over the last 10 or 15 years. That started a number of years ago when an organization that I work actively with, Dallas Area Interfaith, defeated the deputy mayor by getting 500 new people to register to vote in West Dallas and Bachman Lake and Trinity Groves areas, and they defeated the deputy mayor by 400 votes because they registered 500 new people. And she was notoriously neglectful of the people in her community, even though she was from that community ethnically. Fairly typical of the leaders. In that election, the Dallas Citizens Council lost 6 of their 7 races, the first time they'd lost any races in about 60 years. And the mayor, they lost the mayor too at that point. So let's talk about Parkland Hospital. Parkland is our public hospital. I would argue the best public hospital by far in the United States. A lot of that was the previous leadership of Dr. Ron Anderson and the work that he did. It made Parkland more than a hospital with bricks and mortar. It made it a force for community health in the community by opening community primary care clinics and giving people a medical home. Ron pulled that off when he was, and I'm privileged that he recruited me, was the person who recruited me to come to Dallas. Parkland Hospital does a Dallas County Needs Assessment. The last one was 2021, I believe, so they're due for a new one, I think, next year. And they, as well as pulling all of the data, which they've done for the last 30 years, in the last plan, they got a federal grant for the Accountable Communities program that President Obama started. And they interviewed over 15,000 low-income individuals in Dallas County to find out what their social needs were. And there are the big 4. Food insecurity. In some places in South Dallas that I talked about, if you want to go to a supermarket instead of a local convenience store and you don't have a car, your public transportation commute each way is 45 minutes. That certainly is a factor against people being able. We definitely have food deserts. I'm going to show you some data in a few minutes on food deserts and its effect. Affordable housing, and as our population has grown, Dallas, fastest growing city in the country, what's happening is that the housing prices are going up. To compound that, our affordable rental housing is aging out, much of it built in the 70s and 80s, and so some of the places are unrepairable. And we're going to talk a little bit about affordable housing and the latest horrible scam that's not driven by Dallas that feeds into the problems we have in affordable housing. Healthcare access, in spite of Parkland, is still an issue that people have, and transportation for a variety of reasons. Even though we have a pretty good public transportation system, it's still an issue, and therefore people cannot get to needed services. Now let's talk about food insecurity for a little while. And here's the definition from the USDA. I don't think I need to read it for you. And along with that, paradoxically, we've had huge rises in obesity. And notice that Texas is one of the worst states for obesity. I think we have 3 of the top 10 cities in the country in Houston, Dallas, and San Antonio. Now, what kind of effect does that have? This is data from Aetna, from their Medicaid population. And you notice that there is a huge gap per year in healthcare costs for overweight children driven by the effects of obesity. So it is a factor. And why? Because it's all convenience foods. They don't have access to healthy foods. In spite of the WIC program, I did some work when I was in academic medicine looking at the effect of the WIC program, and it came because in the clinic that I was working in as a pediatrician, I was seeing a lot of school-age kids and adolescents with iron deficiency anemia. So I did a project, and what I found out was that below the age of 5, where the WIC program is in place, we had very low prevalence, like 5% of children with iron deficiency. School age and adolescence, it was 11%. What's the difference? No access to healthy foods. What about Dallas and food insecurity? 1 in 6 people in North Texas is food insecure. Dallas County, the rate of food insecurity is 47% higher than the national average. And 1 in 5 kids in Texas is food insecure. 1 of every 10 people in Dallas has diabetes. And 1 in every 5 do not have health insurance. We have seen those numbers dip somewhat because of the Affordable Care Act. I am very proud that I helped organize the marketplace in Dallas, and I still have my letter from Secretary Sebelius and my letter signed by Barack Obama from the White House thanking me for my role in helping get that organized. But the city and the county did a very good job of doing it, and paradoxically, Texas is one of the leading states in the country for sign-up for people. I think only California has more people signing up per year. So the Affordable Care Act, in terms of insurance, has been a tremendous bonus to us in terms of its positive effects. Food insecurity and hunger. Many people have full-time jobs but still are hungry. They don't have access to food, and it's a complex problem. And one of the things that you're going to hear from me when we talk is the need to bring together all the social needs in comprehensive programs rather than one-trick pony programs that deal with food or housing. Programs need to reach a cost, and we'll talk a little bit about how you do that. So this is the food deserts in Dallas. Notice the concentration south. If you draw a line across the city, we have some in the northwest, largely Latino population, but much of it is south. And now, if you look at food insecurity by lack of vehicle, it's almost all south of the main line, and it's between those 2 freeways I talked about. So there's the effect of food insecurity by vehicle, okay? Now we're going to talk about housing. We've talked about food insecurity. Let's talk a little bit about asthma in children and its effect. There was a grant that the Children's Hospital had, the Alliance for Child Health and Wellness, that identified the Dallas City Housing Code had not been updated in 30 years. Dallas Area Interfaith, that same organization that I talked about that unseated the deputy mayor, did community organizing in the largely Latino Bachman Lake area, just north of Love Field, if you know Dallas a little bit. and we identified unsafe and substandard housing. That's still going on, and I'm going to show you some of what's going on, because unfortunately the change that we had did not have the dramatic effect that we wanted. But we did a walking tour of every of 11 housing complexes. We saw raw sewage coming up with drains, ceilings coming in, walls covered with mold, carpets that were stained with mold, and what they were doing with the mold for the leaks behind the walls, instead of fixing the leaks, was just painting over them, which does not take care of the problem. Anyway, the city council passed the toughest housing code in the country by a 13-to-1 vote, with the one who was against asking for stricter changes. One child in 10 in Dallas has asthma. Among black children, the number is 1 in 8, and that's by diagnosis surveys. That's about a 30% underestimate of the actual prevalence. When I was with Parkland Health Plan, and why asthma? It's a major cause of health disparity in children in inner city Dallas. There was a landmark study called the Inner City Asthma Study done in the 90s that showed the effect that we're going to deal with in a few minutes. But notice that when the Parkland Community Health Plan, which I was the medical director of, we went and looked for, we took 4 different definitions of asthma that we found, and we looked at which ones best predicted which children would wind up with an adverse outcome, wind up in the emergency room with an emergency room visit for their breathing, or, and notice I said for the breathing, not with a diagnosis of asthma, or wound up in the emergency room, got admitted to the hospital. And what we found from that data was about 13% of the children in our health plan. About 26,000 children had asthma in a health plan of about 200,000 members. So huge population. And when we started with our intervention, the average child in asthma had almost 1 ER visit or admission per year, was like 0.93, almost 1. And healthcare costs, we did some work looking at the healthcare costs. This inner city asthma study is really key. It was done in the late 90s in 8 cities. Dallas happened to be one of the 8 cities. In one paper by Peyton Eggleston, who I had the privilege of knowing when I was at Johns Hopkins, Peyton's study showed that was the first one that showed the role of cockroach as the major allergen in inner city asthma. If you go to Plano or to far north Dallas where I live, you're not going to find that. You're going to find that it's pollens. But in inner city, the number 1 and number 2 are cockroach number 1 and mold number 2, okay? And then dust mite, which is number 1 and in other areas, and then pollens way down the list. Anyway, so the next study, which was the lead author was Dr. Becky Grushala, who's the head of allergy at UT Southwestern. In that one of the comments was that the sensitivity to cockroach, because that one's specific. By the way, the study was done elegantly. What they did was they went into the apartments or the houses, wherever the people dwelt, and they surveyed the allergens. Then they skin tested children. So they were able to correlate the sensitivity as measured by the most reliable method of determining allergy to what the allergens were that were present in the environment, and they showed a correlation. Okay. In the cockroach study, the study that emphasized cockroach, they make the comment in the study that high-rise housing seemed to be correlated with prevalence of cockroach sensitivity. If you think about that, I know it's difficult for any of us to think as a cockroach, but think like a cockroach for a minute. If you were going to run to the next place to infest it, would you like to run across an open 50 yards or through the walls up to the next apartment? The answer is pretty obvious. So I looked at that and I said, that doesn't make any sense. We don't have any children in high-rise housing in Dallas. Why could that be? And then I went and talked to a friend who's at the EPA, and I talked about mold and cockroach, and he said, well, they missed something. Those, all of those, the cockroach, mold, bed bugs, they all need moisture to survive. Went back and looked at the inner-city asthma study. And in that one, they actually broke the data down by city, which they didn't do in most of the studies. Dallas had an indoor air humidity of 56%. Oh boy. I got ways to go. None of the other cities had more than 28%. So indoor air quality and the poor air conditioning and the leaks behind the walls were what was driving it. So we developed a program with the Parkland Center for Clinical Innovation. I talked about that in one of the last talks. We're very successful in cutting the visits. We then started geomapping, which led us to this data. It showed 3 zip codes in Dallas were greater than 10% of our population. Interestingly enough, people there live in multifamily residential housing. Notice the difference. Inner city asthma study was right. They just used the wrong term. They said high-rise. It's multifamily. You've got 100 housing units or 150 or 200. They don't have to be high-rise. They can be 2 stories. It's that multifamily that drives it. Okay? So we then started doing home visits. We found that 80% of the homes showed housing code violations that would affect the child's asthma. So remember my comments before. Based on my work and looking at the needs, I developed the idea of comprehensive programs using the 6 pillars: food security, safe and affordable housing, healthcare access. Those should look familiar to you. Transportation to support the pillars. Economic development education, absolutely key. And biosafety. And the idea is if you develop a community garden project around food security, you also train people from the community as master gardeners, because then you're dealing with economic development and education. Housing affordability. So what's going on now? Why wasn't what we suggested? This is a key point. What's happening is we have national conglomerates that are buying up houses and flipping the complexes. They're allowing the aging properties to deteriorate. They're avoiding enforcement. They're raising the rents. And the way in avoid enforcement is, as soon as the city starts to catch up with them, they sell it to somebody else. And there are public health and safety hazards, and we do have some solutions. So this is part of the answer. Remember I talked about the bottom. This is affordable housing that we've developed, that is being developed there, under $250,000. And you can see the beautiful units there. Tiny houses, spontan farms, we talked about before, building those for the homeless population. Community gardens, this is at Freedom Missionary Baptist Church. Restorative farms at Hatcher Station is a seedling farm. And they're also training people from the community, solar installers. Joppy Mama Farm in the Joppy community, and those are, you might recognize one of the guys there, and the tall one, and those are all people from the Environmental Commission that I work with. And Paradise Missionary Baptist Church, which also has their program with the local elementary and middle schools to teach both the biology, how you grow, and the nutrition. It's a great policy. And then I want to talk about Temple Shalom in North Dallas, where I belong. We now have, thanks to a federal grant, using these kinds of beds, and you can see the back, we have 64 beds, working partnerships with the North Texas Food Bank, and we are going to be growing 13,000 pounds of produce a year and distributing them. But the places also have to have programs to teach the nutrition. We probably will also wind up working with a local federally funded community health center that has a food as medicine program. This is the 4 Down Food Warehouse. The guy who started this, notice the skate park, he attracts young people to volunteer into the warehouse. By having events, he gets 250 to 300 people, and some of them sign up. In addition, what he does is he gets this community garden will have too much okra, that will much beans. Let's have a warehouse and we can trade off so everybody gets their needs met. It's a brilliant idea. Now, last thing I want to talk about is particulate matter and the environment. And small particles can get down in the lungs. Larger particles, which are allergens, for instance, mold, can cause allergens, but particulates cause all of these horrible things. And not on here is a recent paper that also says GI cancer. So you've got 3 types of cancer, all sorts of lungs problems, heart disease, preterm birth, birth defects, all related to these small particles. And this disparity, and this one speaks for itself. New England Journal Medicine. Particulate pollution is responsible for 150,000 cases of diabetes type 2. And how small, this slide is not portraying well, but these particles are about 1/20th the size of a human hair in diameter, so they're very small. And I did some work. We were fighting a batch plant that has a lot of particulates in South Dallas. So what I went into was a vulnerability index that's been created by the Parkland Center for Clinical Innovation. The zip code that this particular batch plant was in had the second worst asthma vulnerability of any of the 86 zip codes in Dallas County. So you've got lots of comparable zip codes, but this one that omits particulates was the second worst. It says a lot about the severity. And then finally, we have Cancer Alley, which is not in Dallas. It is heavily polluted areas in the country, and the cancer prevalence there is, there are more than 20 facilities, and the cancer rates are 50 times the national average. Plastics is a particular one, so I'm not going to talk about Laurel. And here are some things that you can do as individuals, but I encourage you all to get involved because we need to do something about the health disparities. And I hope this has all been enlightening. And I don't want to make it hopeless. We can do stuff. We're doing it.